Hi everyone, I'm Dr. Scott Theirl. I'm a board-certified chiropractic neurologist and founder of Clinical Thinking CAP, and I'm excited to share with you what we're going to cover in Neurotransmitters 101 class. I've designed this class to be less than 2 hours long from start to finish, with my goal of not wasting time on filler information that isn't clinically applicable. I've been to far too many continuing education classes over time where it almost seems like there's filler because they have to fill so many hours. But man, I like the meat and potatoes. And if you like me and you like meat and potatoes in terms of give me the clinical applications, tell me what I can apply tomorrow, let's go. That is the energy with which I'm trying to put together and have put together the Neurotransmitter 101 class. So if that resonates with you, you're probably in the right place for learning this. I'm going to start with some of the basics for people that are brand new to neurotransmitters, right? What are they? How do they work? We got to get into the next idea that they're not just nervous system, they're nervous system, endocrine system, and immune system a little bit, and how the crosstalk of those different NEI systems work. And then we'll break them down, and we'll break them down in terms of inhibitory and excitatory. That's really one of the best ways to think about neurotransmitters clinically. Now, a lot of neurotransmitters aren't solely inhibitory or excitatory, but when we're talking about clinical applications for our offices, we want to think about inhibitory and excitatory and how does the balance of the system work. You also need to know which of these neurotransmitters are highly involved in the immune system as well as the nervous system, and other applications that you should be doing with your patients from an immune perspective that might help their nervous system at the same time. We'll go into some of the various testing, and the testing isn't going to be specific for any one laboratory. So if you have a laboratory that you'd like to use, that's fine. It's going to be much more about the general constellation of how these neurotransmitters hold together and what it means in terms of patient stress responses. Because ultimately, when the patient is under stress long term, various neurotransmitter systems start to fatigue as time goes on. And I want you to understand those different stages of fatigue so that you can pick the best supplement protocols to support your patients getting back to health. After we go through some of those various inhibitory, excitatory concepts, we'll get into protocols of now that we know here's where we need to go for serotonin and here's where we need to go for catecholamines, what type of dosing should we use and what type of ingredients should we use. The beauty of using ingredients versus specific supplement companies and supplement brands is you can choose whatever supplement company and brand you have available to you. Remember, these classes are available worldwide, right? And so depending upon where you are and what you have available, it may change. But we'll use some of the basic core ingredients that so many supplement companies utilize, and we'll talk about various dosing strategies from how much to the time of day to what to do if people maybe don't feel good on it. How do you adjust the dosage in the time of the day, or other, other ingredients, for lack of a better term, that you could use that would hopefully accomplish the same thing. We'll mention some of the lifestyle changes that should be done for anyone who's looking to optimize their neurotransmitter systems. And then we'll have plenty of opportunities for Q&A. So the real goal here is that this format that we're using, we're hosting it on Rizuku, has chat available to you. So after each lesson, there's conversations where you can go back and forth with other students and with me so that you can become proficient as quickly as possible. I guarantee you, after teaching neurotransmitters and hormones and food allergies and immune system as long as I have, and I've been teaching this stuff since 2005 for various supplement companies and laboratories, if you have one of these questions, somebody else has the same question. So punch it in there and let's actually address it so that everyone's comfortable with it. I think neurotransmitters are a wonderful tool to have in your toolbox as a clinician. I think when we talk about symptoms, including but not limited to fatigue and mood and sleep and attention, right? Attention and cognition. Boy, those 4 symptoms really seem to respond very, very well when it comes to neurotransmitter assessments and optimization. So I hope that you'll join me. That is the Neurotransmitter 101 class here at Clinical Thinking CAP courses. I designed this to be very much clinically applicable in a way that respects your time, respects your knowledge, respects your passion, and regardless of the practitioner you are in terms of your formal training, I think there are applications for our patients and our clients to help support them through their various neurotransmitter systems and nervous system to help them feel their best and live their best life. If you have any questions, please shoot us an email. If you're ready to register, hit the register now button and you'll find out more information on when the next class is being offered. Thank you much. I'm Dr. Scott Theirl. Keep up the good work helping all the wonderful people that you already help. Take care.